Good day, everyone. I am Joshua Nocom, and I'll be presenting my study entitled Functional Outcomes of Conservatively Treated Distal Radius Fractures in the Elderly in Philippine Orthopedic Center, a case series. Distal radius fractures are one of the most common fracture types seen at the emergency department. They follow a bimodal distribution and are the second most common fracture types in the elderly after hip fractures. At the Philippine Orthopedic Center, it is estimated that we see about 500 cases of distal radius fractures in the elderly annually. The presence of this fracture type often denotes underlying osteoporosis in the elderly. Treatment options may vary depending on the observed stability characteristics of the fracture, where stable fractures are treated with close reduction and casting, and unstable fractures often requiring additional fixation. LaFontaine in his study determined certain criteria that correlate with instability, whereas the presence of three or more of these criteria would often lead to loss of reduction. There remains no consensus in the treatment of these fracture types. Physicians must take into consideration multiple variables when treating their patients. These are the issues that led to this research's research question. What are the functional outcomes of conservatively treated distal radius fractures among elderly patients in the Philippine Orthopedic Center? This study was a single-center prospective case series which utilized purposive sampling. Patients 60 years old and above with new distal radius fractures presenting at the emergency department were included in the study with the following exclusion criteria. Informed consent was taken and patient demographics were recorded. At the emergency department, patients underwent closed reduction and application of U-mold, which was then changed to a below-elbow circular cast at first week of follow-up. X-rays were done during the follow-up at 6 weeks, at CATS removal 3 months, and 6 months where radiographic parameters of the wrist were measured. Pain scores were also measured at the same intervals. DASH scores were obtained during the 3rd and 6th month after injury. 43 participants were included in the study. 7 were lost to follow-up and excluded. The mean age of participants in the study was 71.36 with a predominance of females. These are the graphs showing the different measurements of the radiographic parameters throughout the study. In general, there was a loss in radial height and inclination from the initial improvement at 6 weeks. There was no significant change in the palmar tilt after 6 months, and there was a significant shift in the ulnar variance of the patients, favoring ulnar plus. Wrist range of motion showed significant overall improvement at 6 weeks post-casting. DASH and pain scores are shown here, showing a significant decline in both parameters over a span of 6 months. Age is seen as a statistically significant predictor for secondary displacement, and late displacement is common in the elderly due to decreased bone densities. Outcomes are not entirely predictable because of wide differences in patient profiles. It can be inferred, however, that the elderly can tolerate greater deformities of the wrist due to the decrease in their functional demand. This study shows similar results to a study conducted by Aparicio et al. Mean radiographic parameters show poor results in this study despite a better mean DASH score. This may be attributed to a lack of a specific post-casting rehabilitation program or differences in functional demand in the patient population. Results from this study may be improved by a larger sample size and a longer follow-up period. Future studies may also include a single-center comparative study between surgical and conservative treatment done for this age group. This study suggests that conservative treatment for distal radius fractures in the elderly yields good outcomes in terms of wrist range of motion, pain, and DASH scores, despite poor radiographic parameters. Loss of radiographic parameters in this patient population does not directly correlate with decreased functional outcomes. Thank you everyone for your time.